Hello and welcome back to the Listening to Your Gut podcast. I've said it before, but I'll say it again. I love reading books and then being able to have conversations with the authors. And this conversation is one of those. So I'm super excited to be welcoming Dr. David Clarke to the podcast. Here he is. Hello and welcome. And I want to just tell you a little bit about him. I mean, he will dive into more, I'm sure, but um, Dr. David Clarke is the president of the Association for the Treatment of Neuroplastic Symptoms, which is a nonprofit dedicated to ending the chronic pain epidemic. He has his medical degree from the University of Connecticut School of Medicine. He is a board certified internal medicine and gastroenterology doctor. And his organization is on the mission to advance the awareness, diagnosis, and treatment of stress related and brain generated medical conditions. And he's the author of several books, one of which we're going to be really diving into today, which is They Can't Find Anything Wrong, seven keys to understanding, treating, and healing from stress illness. Excuse me, I just butchered that a little bit, but it's a mouthful, but it's something I told you, Dr. Clarke, that everybody can relate to. I mean, myself, I know for sure because this book spoke to me. And we're going to dive into it. But yeah, let me just stop myself because I'm getting too excited. Welcome, Dr.
Thank
Clarke.
you. Thank you very much, Kelly. It's great to be with you, and I appreciate your sharing this information with your viewers and listeners. It's
Absolutely.
an area of that issues that a lot of people don't recognize, and that when you don't recognize the kinds of problems that we're going to talk about, it can be like swimming against the tide when you're trying to improve your own wellness.
Absolutely. Yeah. I think y- if you're someone who is listening in right now, I think we would be naive to say that you've never had stress, right? Everybody's experienced stress. And so this book, I think, is profound in that, I've never seen anything like it that really outlines, what are the big areas of stress that, plague our lives and what can we do about it? Because, we talk about stress all the time. We're in stress, many, many days of our lives. And there's not really any discussion, out there in book form of how do we go about that. So I would really like to start off with, what really drew you to this type of work and really this avenue of really dealing with, stress.
Yeah, well, I started off as the most traditionally Western trained physician you can imagine. And I did pretty well in that environment. I mean, I got an award for excellence in medical school, and I got into my dream residency program. I got high scores on my board exams. So, I thought I was going to be an excellent physician, and that after 7 years of formal training, that I knew how to be a good doctor. So the last thing that I expected was to encounter a patient that I didn't know the first thing about diagnosing or treating. And this happened in the eighth year of my formal training out of a total of nine.
Wow.
And it was a patient who was, I was studying to be a gastroenterologist, and it was a patient who was averaging one bowel movement per month for 2 years, that was not changing at all in response to her taking four different laxatives at double the recommended doses.
Oh my God.
And I should probably back up for a minute here that traditional training is that if you've got pain or illness, you must have a disease or injury to explain it. And that's how I was trained. That's how all healthcare professionals typically are trained.
Mhm.
But it turns out there's this whole other category of illness where your brain can generate pain or illness in your body in the absence of there being anything physically wrong or any biological explanation for your symptoms. And
Yeah.
it's embarrassing to admit as a physician, I got to year 8 of my training without any familiarity with that. The good news is, I don't want to, have everybody watching your podcast turn everything off because, oh, this guy is bringing me down. He's very depressing. Uh,
No.
but the good news is that there is effective treatment available for this. I mean, people who've been ill for years can absolutely turn this around and achieve complete relief if you know what to look for. And the physicians who learn how to do this, they absolutely love it because suddenly all these patients, 40% of the patients who come to primary care
Yeah.
that were making them beat their heads against the wall because they didn't have an organ disease or structural damage.
Right.
Now they know what to do when they take this training that we have on symptomatic.me. In any case, this patient, I absolutely had no clue what to do for her because all of her tests were normal. She'd already had most of the tests at another university. I was at UCLA. We did some specialized testing of the large intestine, and that was normal too. And I stumbled on the fact that she had stress when she was a girl, fairly massive amount of stress when she was a girl. She was molested by her dad, very sadly, and but now, she's 25 years since all of that, but it's still affecting her. And I didn't know what to do about that, but there was a psychiatrist at UCLA that did know, cured this patient with less than 3 months of counseling. And that blew my mind that you could alleviate a serious physical condition just by talking to somebody. Nothing in my 7 years had even hinted that you could do something like that.
Yeah.
And I thought that was so amazing. And I didn't think I would use it very much, but I wanted to learn how she did it. I wanted to get that basic framework. And so over the last year and a half of my 9 years, she taught me the basic approach. And I thought, a couple patients a year, maybe this will come in handy. And when I uncover these issues, I'll just send them off to whoever the Harriet Kaplan is. That was the name of the psychiatrist, whoever that is in my community in Portland, Oregon, and it'll be fine. Well, I was wrong on both counts. The patients, without even trying, there were 5 or 6 a week like this with no uh, disease or injury to explain their symptoms. And with some kind of stress in their life, past or present, that was in fact responsible for the condition. And I would send them off to mental health and they would come back because they would mostly get, not all of them, but a lot of them, they would mostly get cognitive behavioral therapy, which doesn't work very well. And it's by far the dominant form of psychotherapy in the US. So when patients would get this, a lot of them wouldn't get better. They would come back and they'd say, I went to mental health, now what do I do? And I had this framework from Dr. Kaplan. I said, I will do my best. I will see, if I can give you some advice that I've been trained to do and see if you get better. And people got better. I was a bumbling beginner. I'll be the first to admit it. If there was a video of me back then, and I was forced to watch myself back then doing this, I'm sure I would beat my own head against the wall at how ignorant I was. But, it's like anything else. You do it, you get better.
Yep.
And I climbed the learning curve. It took me 5 years, during which I probably saw close to 1,500 patients with this, and I was getting better and better. And not by coincidence, when I finally felt like, okay, I think I know what I'm doing now,
Yeah.
I got the Doctor of the Year award from this, huge HMO that I was working for. And
Yeah.
I was still in my 30s. Most people who got that award were a lot older. So it was a real validation for the work that I was doing. And the word got out that I was, taking care of these sort of medically unexplained patients. And they started sending me, anytime they had a medical mystery, I became the go-to person for that. And people with back pain would come, one guy with total body itching for 3 years,
Wow.
all kinds of different symptoms from head to toe that, nowadays, migraines and chronic fatigue and long COVID and fibromyalgia and irritable bowel was my usual, but
Yeah.
lots of other stuff, pelvic pain, genital pain, trouble swallowing, dizziness, ringing in
Wow.
the ears,
Yeah.
pseudo seizures, on and on and on. And some of them would have more than one symptom. A lot of them would have more than one symptom at a time. That
Sure.
was quite common, but they're all treatable.
Yep.
These patients I was at least as successful as I was with the other 2/3 of my practice which was people who had organ diseases or structural problems. So it was very rewarding work and it, encouraged me to keep going.
I love that. It's incredible too. I mean, you talk about it in the book and you've mentioned it too here in our conversation already. But one of the key pieces I feel that is missing, to diagnosing these stress related illnesses is truly just having that time as the patient to be able to share, right? But then also to be able on your end to ask the right questions. And I mean, as we can tell through the book and through what you've shared thus far, is like you know the right questions to ask. You even share several questions, to be asked in the book, which I love too, for medical professionals to utilize as well. And I just think, like we mentioned off the mic before we started recording, we just need this to become more mainstream, and we're getting there. We're stepping towards in the right direction, but I welcome the day when this is just like mainstreamed, and this book is in the hands of every single medical professional so that they can reference it and recall, look back to it and remind themselves like this stuff is important, and you don't learn about it in middle school, but you need to, like, it needs to be part of the teachings, because in this day and age, we have so much stress, on our plates, and it comes from so many different avenues, so many different ways that it's inevitable, right? So I think my next step here is really for you to kind of, if you could, in layman's terms, like what is stress illness? And I know you break down five key types of stress illness in the book, and I don't want us to, I want everybody to read the book, but if you could like tell the listener, how do we define stress illness, and what are some of the different ways that comes up?
Yeah, that's a good series of questions there. I have to
Mhm.
say the terminology has evolved since the book came out, and my colleagues and I now refer to this as neuroplastic symptoms because it's generated by the brain and nervous system. And the term plastic is actually quite hopeful because it means a capacity for change.
Right.
And we've absolutely seen this in brain scan studies where the neuroanatomy, the nerve circuits in the brain have been changed by stress or trauma or emotions or some other kind of life challenge, but they can change back. And the Boulder back pain study scanned the brains before and after treatment and showed that there were changes in the brain just from the new kind of neuroplastic recovery therapies that we have today. So it's more than just me and my 7,000 plus patients and the stories that come out of it. We've now got, for any healthcare professionals who are watching, we've got well-conducted clinical trials with control groups and that show dramatic benefits from this. The Boulder back pain study, people with an average of 10 years of back pain had 75% reduction in their pain in 1 month of treatment with this with one of the neuroplastic recovery therapies. And there that kind of result, it was just, it was shocking even to the researchers how good it was. And it's been corroborated by the studies across North America. So I want to emphasize there's a really good scientific basis for this.
Yeah.
But the approach that I take is just first, get the story of the symptoms, when and where did they start, and what's been their course over a period of time,
Yeah.
and that can tell me a lot right there. And then I'm looking at stress in the person's life. What kinds of issues do they have? Did something stressful happen right before they became ill, for example? One of my patients, her right, she'd been ill for 5 years, but nobody asked her if she'd been through any kind of trauma, and right before she had these symptoms start. And it turned out that her parents and her husband were in a serious motor vehicle accident right before she became ill. The parents were killed, and the husband spent 6 weeks in intensive care before making a full recovery. She wasn't in the car, but obviously it was a huge trauma in her life, and her symptoms started right after that.
Mhm.
And there were some other clues in her case that made it clear that that trauma was the start of it. But an even simpler example was a guy that had already been evaluated by several doctors for stomach pain with nothing being found. So he was one of these mystery cases that was sent to me. And it turned out he only got his pain when he was driving to work. When he was driving home from work, he was fine.
Wow.
Ditto on the weekends. When he was not at work, he was also fine. So, obviously the next question is, hey, what's going on at work? And when did the stress begin in relation to your symptoms? And it was perfectly matched up. His symptoms and his big stress in the workplace matched in their timing perfectly. And just his becoming consciously aware of this connection was a huge relief to him because he'd been obviously worried that he had some tumor that hadn't been found yet or some other serious condition. But then to see that it was connected to his workplace um, was a big relief to finally have an accurate diagnosis. And he could go to his supervisor and say, look, we need to make some changes. And that was a good solution for him. Another gentleman, um, again, I'm a gastroenterologist, but people started sending me all kinds of stuff. This man had back pain for over 25 years every day, um, except 2 weeks out of the year.
Yeah.
So, okay, do you think he's doing for those 2 weeks out of the year? He's on vacation.
Yeah.
And so I'm going, okay, well, maybe he's resting his back on a warm beach somewhere, and that's why his back doesn't hurt on vacation. But no, he's fly fishing in British Columbia. So he's wading out into the river. He's, casting the fly rod. He's bending over to net the fish. He's doing all this stuff. And then he tells me at the end of the day, when he's done fly fishing, he's helping the lodge owner clear brush from behind the lodge. Is his back hurting when he's doing any of this? Not a bit. It feels great. As soon as he comes back home to his stressful life, back pain starts up again. That is clearly not structural back pain. That is brain generated from stress. And the solution there was it ended up, he had some major issues that made it difficult for him to work through a good solution. Some of my more challenging cases I put into a course that we have on symptomatic.me, and he's one of them. But I mentioned him mainly because it was so clear that he did not have a structural back problem, which it turns out there's a study in a year and a half ago that showed that 88% of people with back pain, it's not structural.
Yeah.
It's neuroplastic or stress related. So I'm
Yeah.
sorry, I'm wandering off into
Oh,
my
I love
stories.
that.
Uh,
That's incredible. Yeah, so I mean, I think my next kind of question related to that would be, okay, so we know obviously that our brain is connected to our gut. We know, the vagus nerve, we know that whole connection, right? My question is, I'm sure you have you also woven in like that traditional Chinese medicine approach of like the meridians and like the organs and what, different feelings are associated with those? Like, does that play a part in, I'm sure, your research, but also like your practice too?
I not traditional Chinese medicine, no, because those feelings clearly exist, and um, the brain and the gut talk to each other obviously all the time. I mean, the number of nerves in the GI tract is comparable to the number of nerves in your spinal cord. I mean, it's been referred to as a second brain, and there's lots of communication going on between them. Everybody's had the experience of what are called butterflies in the stomach or a knot in your stomach when you're in a tense situation. That is the bodily component of an emotion. And what often happens in people with these conditions, with neuroplastic symptoms, is that they're having the emotion, but they're not consciously aware of it.
Mm.
So, when we get angry or afraid or have some other, particularly a negative emotion, but any emotion, there's always a bodily piece to it. It's always felt in the body as well as in the mind. But if you are in a situation where your emotions have been tightly controlled to the point where you're not consciously aware of them in certain cases,
Yeah.
then you get the bodily part of the emotion without knowing why is my body doing this? And it's
Right.
actually, you're having an emotion, but you're not consciously aware of it. And the big source of this, one of the biggest single sources of this is adversity when people were children, what are called adverse childhood experiences or ACEs. And that was huge in my practice. Well over half of my patients had experiences as kids that they would never want for a child of their own, for example. And um, that's an important way to frame it because many people, when they look back, they will tell me, oh, it wasn't that bad. Other people have been through worse than me, and they don't seem to be all that affected by it. And or they'll say, I think I'm over it. And my very first patient with the one bowel movement per month, she had been molested by her father on unfortunately many occasions. But she was telling me the story in the same tone of voice you would use to read a grocery list. That you could, if you didn't know better, you would not know that there was any emotion going on there at all.
Yeah.
And the emotion was there, it was just being manifested through her body. And it wasn't in her conscious awareness. And that's why it wasn't getting any better. She had very powerful emotions
Yeah.
that had come on, in midlife, which is quite a common occurrence. That people will often be physically well for many years until finally ironically, their recovery process from the ACEs reaches a point where the emotions are ready to be knocking on the door, so to speak. And when they knock on the door and they can't get the door open,
Yeah.
they try to talk to you in some other way. And in her case, it practically shut her bowels down. So that's something I always look for. And when people say, yes, I went through such and such bad things when I was a kid, but I don't think it was, all that significant, I will ask them to imagine a child of their own growing up in the same environment while the patient is a butterfly on the wall and is watching the kid try to cope.
Yeah.
And how would they feel while they were doing that? And that puts a completely different spin on it and
Yeah.
helps people get a much more accurate sense of how much they had to deal with. And once they're consciously aware of some of these things, it helps them to connect with the emotions, and then we have something we can talk about.
Wow. I mean, it makes so much sense. And I just keep thinking to myself, we need you cloned all over the place, right? We need you like in so many places because this conversation we're having it is so needed, right? It's not, I've said this before, but I'm going to say it again. It's not talked about enough. And to the cases that you've shared thus far and the cases that you've shared in the book, so much of this we just suppress. We just push and push and push down until, like you said, it eventually surfaces and then it's manifesting in these different ways in our bodies. And it's miraculous how, the studies in the book, and what you've shared here, how, once we get to the root of it and we uncover it and we start really dealing with it, how people, it's almost like a light switch. They just like all of a sudden, not always, but a lot of them, they like magically the next day are like feeling so much better. And so I know in the book you share several different ways. I mean, of course, there's so many different um, stress categories, if you will. I mean, you talk about, of course, we've hit on childhood stress, current stress. You talk about in the book anxiety, which, I mean, hello, who in this day and age doesn't have, a little bit of that, right? And I love how, especially when we're talking about stuff that's happened in the past, potentially the childhood stress. You talk about the impact of writing and journaling and like getting that out. Can you talk to us more about like the significance of that and why that is so crucial? Because I know that, through therapy, going through therapy myself, that was one of the strategies that my therapist would often, rely on when I was chatting with her. But I also know that it's super powerful, for others that I've chatted with too. On the flip side, there's a lot of people that I know too that roll their eyes and are like, that's not for me. I can't journal it. Or they have a complex around like, I can't put what I'm really feeling on paper for, X, Y, and Z reasons. So can you talk to us more about like the importance of journaling and just even writing things out?
Yeah, no, there's a lot to unpack there that you went
Yeah.
over, which is you said so many important things there. But
Yeah.
yeah, writing is a really powerful technique, but it has to be prepared for. We want people to write something that's meaningful. And the more that a person can put emotions onto a page, good and bad, particularly about a significant person in their life, especially from their childhood past,
Mhm.
then the more those emotions wind up on a computer screen or on a piece of paper, the less they need to be expressed via the body in the form of symptoms. But it has to be prepared for so that you're actually consciously aware of some of those emotions. And that exercise of imagining a child you care about growing up as you did can really help people get a realistic, accurate sense of how much they had to endure. And it can help connect them with those emotions because oftentimes people looking back at themselves as a kid, they're not seeing it. They had to learn to suppress those emotions as a survival technique. So as an adult, the emotions are locked away somewhere. But if they're thinking about their own kid trying to deal with the same stuff, or another child that they care about, then that kind of unlocks that door and lets them get access to the emotions. Not everybody benefits immediately from doing that. Some people need years of psychotherapy to achieve the same outcome, but to me, it's a necessary step. However, fast your healing rate is going to be, getting access to those emotions is essential. Another important point that you raised is, do people feel worthy of putting emotions out there, especially negative ones, about somebody that they simultaneously also care about? And many of my patients come out of their ACEs experience feeling like they're not quite good enough as people, or feeling second rate, or in some cases, feeling worthless
Mhm.
by their early experience. And consequently, there are a lot of long-term impacts of that we can talk about: personality traits, the emotions, certain triggers in your present day life that are highly stressful because they are reminiscent of the past. But one of the big ones is just recognizing that if you were watching a kid of your own going through the same experience, and let's say you watched them for a week or so, go through that, you would probably be quite proud of them that they made it through that week.
Yeah.
And I want my patients to then transfer that pride to themselves,
Mhm.
because most of them uh, didn't go through this for a week. They went through it for 1,000 weeks, in round numbers.
Yeah.
And, how much more pride should they have for themselves?
Sure.
And, that begins a real important flip in a person's self-image, from feeling like they were second rate to recognizing their own heroic perseverance in what they came through. Another analogy I use is for people to imagine that their early life was like getting parachuted into the Himalayas as a toddler. And through no fault of their own, they find themselves in this harsh environment and they have to find their own way out. And they should get tremendous credit for that.
Yeah.
It's kind of implied in medical school that people that have neuroplastic symptoms are mentally weak, or they're neurotic, or they can't handle their own stress. Just the opposite. is the case. These patients are among the strongest people I know. They're like Olympic weightlifters who've been asked to carry 50 pounds more than the world record for their weight class.
Mhm.
Anybody's body is going to break down under that kind of load.
Right.
And the process of treatment is to teach people how to take that load and put it down. And when they do, they find out just how strong they've been all along.
Yeah, I love that. That's incredible. And you know, throughout your book, I felt like there was this common theme of, a lot of our experiences do come from childhood, whether they are, to your point, like you know, um, abusive situations and things of that likeness, or they are just parents didn't know how to parent, right? And because of that, child needs were left unmet, right? I know that comes up a lot through the book, and um there are a lot of people that can relate to that, but I wonder, for people such as myself, as I was reading through, I wondered your thoughts on this. I grew up in a great home, great parents. I don't feel as if, I'm sure, everybody's got something, right? I'm sure there's something lurking, hiding underneath, but I feel as if I was parented great. I had a great upbringing, but my downfall was myself. It was me, trying to be a perfectionist from societal views, not from, parents pushing that on me, but like what I saw in society and just the way in which society functioned, during my upbringing. So I wonder your thoughts. Like, what does someone, millennial of my age, what does someone who's gone through that type of experience, uh, do they deal with that stress any differently? Or, how is that approached?
Yeah, I should add that it's the adversity for kids is not always the obvious stuff. In fact, quite commonly, it's not the obvious stuff. Not physical abuse, sexual abuse, parental substance abuse, violence in the home, death or divorce going on. It's often not something so overtly obvious that the pressures on a kid can be very subtle. The pressures can be enormously high, even from parents that mean well and are trying to do their best for their kids and raise them to be successful adults. They can oftentimes create a situation of very high pressure without even recognizing it, and with the best intentions in the world. So a lot of my patients say, my parents cared about me. They wanted the best for me. They were always trying to, support me. But as we talk, we find out that there was a certain amount of pressure going on that, because none of us has a parallel life to compare ourselves with, people didn't fully recognize how much pressure they were under. One of my patients, it took him a while to recognize this, but he finally realized that when he was growing up, the only time he got praise from his parents was when he did something better than his brothers and sisters could do it. And he had three very accomplished siblings. It was not easy to do something better than they could. And so as a result, he grew up feeling like a failure, like he felt that constant need to perform and to be perfect and to pay attention to details and to work hard and to take care of everybody else that was around him. And now he was in my office as a 37-year-old attorney with all kinds of physical problems and personality traits that are common in people who are ACE survivors,
Mhm.
relationship issues and difficulty putting himself on the list of people he takes care of because he was so busy taking care of everybody else. And he was living as if on a treadmill he never stepped off. And sooner or later, when you do that, your body is going to protest.
Yep.
And so it wouldn't surprise me if we had a long conversation about exactly what went on when you were young. We might find that there was more pressure there than you think.
Yeah.
And again, it can be with all the best intentions in the world.
Sure.
Parents want their kids to succeed.
Yeah.
Um,
That's incredible. I appreciate you sharing that because, yeah, I think that for me that deserves some more digging to find that root. I'm curious too, in this next generation that we're bringing up, in this digital age, and the stress that comes from technology, right? When I was a kid in elementary school, nobody had a cell phone, and now everybody's got a cell phone. And there's so much social media that bombards children at such an early age. Have you, in research or just in your practice, noticed anything of that sort coming out and kind of, providing, if you will, almost another um, category of stress that people are um, almost diagnosed with?
Yeah, it's a little bit controversial. There are some studies that suggest that the advent of cell phones and social media has accelerated anxiety and depression amongst young people. And then there are some other studies that seem to contradict that. But definitely worrisome that social media and the instant communications that we have nowadays can accelerate some of the negative aspects of communication among young people that have always been there.
Yeah.
But if they're getting hyped up, a rumor can spread from, a couple of people to the entire school in no time.
Yeah.
And I can also add that people who are challenged at home by adversity and who are, as a result, kids take a lot of responsibility for any kind of badness that is going on in their home, and they're going to feel um, less about themselves when the home situation is a struggle. And what that does is it makes them more vulnerable to bullying. There's always going to be a bully in a school environment, and they're always going to be on the hunt for somebody that's vulnerable to what they do and somebody that's coming out of a home where there are struggles of one sort or another is going to be that person, that vulnerable person. And so they're going to be targeted by the bullies, and that's just going to make things worse. And then you accelerate it because of social media and cell phones, and it's going to make it even worse than that. So I think there is a big element of that going on. And this is why in my treatment of patients, most of whom are adults, but I did have a number of adolescent patients over the years, is to try to flip people's image of themselves completely around and say, look, you are in this challenging environment. It is through no fault of your own. And you deserve tremendous credit for your heroic perseverance in dealing with this.
Mhm.
And you should think of yourself in very positive terms as a result. And, people are not going to flip a switch and be able to do that instantly. But if they can start to learn that way of thinking about themselves, or that Olympic weightlifter with the big burden that they're carrying, think of themselves like that,
Yep.
then it makes them less vulnerable to bullying, and that can take a vicious cycle and turn that around. So to me, that's one of the fundamental treatment approaches is to um, give people a sense of they're actually a lot stronger than they think.
I love that. And I think if we all just heard that more often from doctors such as yourself, I think we'd all be in a much better place. I mean, how often do you hear that from a doctor? Even as you said it comforted me. I was like, gosh, yes, we all have. I've been, you've been, we all have been through a lot, and like giving ourselves more grace, more appreciation, more understanding, more sympathy, um, and being less harsh on ourselves could
Yeah,
do.
and the severity of symptoms that can turn around from this kind of approach, it amazed me. I mean, I was not expecting uh, just how severe the symptoms can get from what your brain can do to your body. One of my patients had a completely paralyzed stomach, not the abdomen, but the stomach, the organ,
Yeah.
was not emptying at all. And it turned out to be completely from stress. Another patient, 79 years of abdominal pain. Another patient I was asked to see, a 17-year-old boy on his 70th day in the hospital. They asked me to come and see him. He had been having unexplained abdominal pain for a year and a half. He'd already been seen by six other gastroenterologists who had not diagnosed what was wrong with him. He was getting morphine in massive doses around the clock, doses that you would normally give to somebody with widespread cancer pain, which
Wow.
he did not have, definitely.
Yeah.
And all three of those patients were successfully treated with a neuroplastic recovery therapy approach. So
Yeah.
it shows you just how severe this can get, but also shows you that uh, the treatment is highly successful once you find out what's going on.
Yeah. And I it begs the question to for me to ask you, what I know every person is different and as it should be, every treatment plan is then different, but what are some of, the common s- treatment plans for people? Like, we hear a lot. I've dealt with the gastrointestinal symptoms, and in your book, you share a lot of people who that is their dominant symptom is gut related issues. And we've talked a lot about that today too. What are some of the like tried and true. I know they're all good, but I'm saying like what are some of the go-to things for people who are feeling that way? Maybe someone's listening right now and thinking, God, I know I have, like some childhood stress that is unresolved, and I do have, gastrointestinal symptoms right now. What are some things that they can start to do?
Yeah, one of the first steps, especially for chronic pain, but to a certain extent, the gastrointestinal symptoms as well, is to take the attention that you're giving to the symptoms and shift it from your body, where it naturally is going to go, to shift it to your brain and thinking about, well, what could be going on there? What kinds of pressures from the past or present might I be coping with that could then be impacting my body via my brain? And just by doing that, just by starting to think about where the stresses might be coming from, making a list of stresses you have in your life today and a list of stresses you had in your life in the past. And then taking a look at those and thinking about, well, are there any of these that maybe I could make a difference with, make a change in? That's a very simple place to start. It is, the basis of one of the neuroplastic recovery therapies, just shifting attention, recognizing that your body is actually okay. Most of my patients, by the time I saw them, they had had their medical diagnostic workup, or they just needed a couple of simple tests from me to find out there was no organ disease or structural damage. And once we've ruled that out, then we can start focusing on the stress issues. The next area I'd ask about is, what stresses did you go through as a kid? And we would try to find out what those were and help people understand the impact of those. The long-term impact, as I mentioned earlier, it falls into three categories, all of which can be treated. First is the personality traits. Many people, to survive their early adversity, had to become, perfectionist and driven and hardworking and detail-oriented and excessively self-critical. Another long-term outcome is not taking care to put yourself on the list of people you are taking care of. Many of my patients are the sorts of folks that they're always working on behalf of others in their life. If they get a small amount of free time. They're not thinking about taking a moment for their own joy. They're thinking about what useful, constructive thing they could be doing instead. And if you don't take regular time for your own joy, sooner or later, your body is going to protest. And one of the ways it can do that very commonly is through chronic fatigue. Many of my patients have just they hit the wall and they can't do anything. I mean, there was a person that I met last year who was for over a year. All she could do was crawl from her bed to the bathroom and back.
Oh,
Just was completely wiped out in terms of her energy level. So that's, those personality traits. Oh, and one more of the personality traits is a tendency to choose people for your close personal relationships, your romantic relationships, who have problems or needs or issues, so
Mm,
that you find yourself having to support that person, having to, meet their needs, having to focus on helping them, and you don't get the same amount back in return. So the relationships become unbalanced and they have a tendency to become more unbalanced over time. And many of my patients have, they end up breaking off those relationships because they're not working for them, only to choose the next person with the same issue. Um, so that can go on for quite a while and until the underlying cause is uncovered and dealt with. Second major area are triggers,
mm,
people, situations, or events that are highly stressful
yeah.
because they are in some way linked to the past traumas or stresses. The most common example of that is having a parent who mistreated you still in your life today.
Mm,
And the very first story in my book was about such a patient who was
yeah.
hospitalized 60 times at a prestigious university with no diagnosis.
Yep.
And all of her attacks of dizziness and vomiting happened in connection with her abusive mother.
Yep.
I don't want to give the story away too much if
Oh,
people are
yeah.
going to read the book,
Yep.
but
Absolutely.
and
Yep.
then the final area, as we've already talked about, is the emotions. In order to survive, all of these personality traits come about in order for the kid to survive their stressful environment. And the emotions are the same. The kids have emotions when they're mistreated,
Mhm.
but in order to survive the childhood experience, they have to bury them. And they get very good at it because they start practicing the suppression of their emotions from a very early age. So as an adult, they can have pretty strong emotions and not be consciously aware of it. So they get the bodily manifestation of the emotion without any of the other parts of the emotion. In other words, you have the anger, but it's only in the body, not, you're not consciously aware that you're angry. That was the issue with that first story in the book. Patient was having these, the anger was manifesting as dizziness and vomiting,
Yep.
but she didn't know she was angry.
Right.
Um, so all of those things can be successfully treated when people find out that they became perfectionists because that was their way of dealing with the situation in their childhood home, trying to fix everything, trying to be the best little kid they could be. Then they can give themselves more of a break. They can recognize that they got parachuted into the Himalayas as a toddler, and um, they deserve to give themselves a ton of credit for having made it through. And
Absolutely.
as you give yourself credit, then you don't have to be perfect because you feel good about yourself as a human being.
It just reminds us too how, I mean, if you take a moment to step back and think about the human body, how incredible is it that our body, tells us that there's something that we're dealing with, right? Like through those ailments, through the ways that we feel, like our body is truly trying to take the best care possible of us as it can. And those symptoms that come up from stress related, you know, issues are your body's way of saying, "Hey, help me. Like I want to process this. Let's get better." So I mean, time again through the book and through our conversation today, it just brings me back to how incredibly awesome our bodies are. We know that to be true, but when we take the time to really think about it, it's like, wow, how fascinating is that?
Yeah, I'm amazed to this day, and also amazed at how people can turn this around. I
Yeah.
have seen so many people who were so ill for so long. I've got a new podcast myself called The Story Behind the Symptoms, where I interview patients who've been through this. And the very first one was a woman who had this for 30 years, and starting at age 5. And she was able to turn this around. I mean, she doesn't have symptoms anymore. And in fact, she uses her experience to help others. I mean, she's a wonderful woman. And we're coming out with a new one every couple of weeks now. So these are all people who have been, remarkably symptomatic, who are able to turn things around. It's just really, really striking.
It is. I mean, I know we could be here all day. I have so many questions for you, but two are top of mind and very pressing. One is, I'm not myself a parent. I mean, to little fur babies, but not to a human child. But I know so many women listening in do have children, and I wonder, for the parents out there, which is probably most, that want to do the best for their child, what would you say to parents listening in that, think, gosh, how can I support my child, in the here and now to set them up for maybe less stress down the road, to maybe have less uh, adverse childhood experiences, down the road when they become an adult.
Yeah, it's a really excellent question. A lot of my patients have been reluctant to become parents because they're afraid they're going to do a terrible job because their own parents did a terrible job, and they don't feel like they have a role model to do any better. But, what I tell people is that my definition of a good parent is somebody that does a better job than their own parents did. And, patients hear that and they go, well, Dr. Clarke, that's kind of a low bar in my case, but uh, you know, if you are doing a better job than your parents did for you, then you are helping to break the cycle. You are changing the progression of these issues down through the generations. So many of the parents of my patients had issues when they were kids, and who knows how many generations back it goes, but probably a long way. So that if you can break that chain, break that cycle of mistreatment of kids, even if you're not perfect, that's okay. You are taking a big step, and your own kids are going to be grateful for that. And parenting is way too difficult a job. Nobody does it perfectly.
Right.
But one other area that I would that I've learned myself from my own patients that helped me with my own parenting
Mhm.
is when your kids are adolescents, it's important to recognize that after they go out of the house for the day, they are constantly encountering messages about their own shortcomings. That they're going to hear it from every which way, from their teachers, their coaches, if they're in the arts, their instructors, their peers in the classroom. Everybody's going to be letting them know if, whatever shortcoming they've got, somebody's going to make it clear to them, that they're not a good enough athlete or artist or performer or student, or their clothes are falling short or their ears are too big, whatever it is, they're going to be getting those messages. And if when they get home at the end of the day, a well-meaning parent is pointing out to them more shortcomings that they have or more ways that they can improve, then they never get a break from that. If I came to your house and I followed you around and I, with the best of intentions and meaning well, pointed out to you every time you fell short in some way, it wouldn't be long before you drop kicked me out your front door, right? But if you're a kid, you're not going to do that to your own parents. So what I tried to do was make my home an oasis of support as much as I could.
Mhm.
And when my kids screwed up, which being kids they always did, I would try to bite my tongue and let it go because mostly they already knew that they had screwed up. They didn't need me to pile on. So instead, I tried to notice when I saw them doing something well. And I would let them know, that I had noticed. And I wouldn't make a big deal about it. I wouldn't jump up and down and shout and scream. I would just say, oh, I noticed that you did this thing very well, and I was proud of you for that. And, nothing more than that. And, they really appreciated, coming home and having that be the one place where they didn't have to put up with other people showing them their shortcomings.
Yeah.
And, you might think, well, Dr. Clarke, your kids are undoubtedly became slackers as a result of this. They didn't have the parents to push them, and so they're screwing up in all kinds of ways, and they're probably living under a bridge somewhere. But the opposite is the case. I mean, they liked that I noticed when they were doing things well,
Good.
and it motivated them. And they ended up doing, they're around the age of 40 now, and they're doing incredibly well in their lives. I couldn't be more proud of them. in multiple dimensions. I mean, they're good musicians. Their wives and families are great. They cook meals for their families. They competed as athletes at the national level. They're just amazing kids, and they are raising their own kids kind of in the same way that they were raised. So I'm very pleased to see that.
I love that. And I love the advice too. You are just incredible. I just can't
Thank you.
appreciate, yeah, I can't appreciate, I can't let you know, or how should I say this? I can't accurately describe how appreciative I am of just everything you've shared today and the knowledge in the book and the continuation of the studies that I know are going to come out from here on forth. And I do have one final question that I would love to wrap us up with, which is, in your book, you describe in the last chapter, and we talked about this off the mic. Just when I was getting to the end of the book, I thought, gosh, it would be so great if Dr. Clarke, could somehow spread this to the masses of doctors and give them a framework to work with and to show them how important these conversations are with patients. And lo and behold, you did it. You did it in chapter 11. And so, I would love for you to share with hopefully doctors that are going to be listening in, but also with patients, individuals who are listening to this podcast as well. What do you hope to see, in the next year, 5 years, 10 years down the road, in terms of the evolution of, this knowledge being spread more mainstream and far and wide to doctors and to their patients.
Yeah, I mean, I would love for it to become common knowledge that your brain can cause real pain or illness in your body, even in the absence of there being anything physically wrong, and that your brain is doing this because somewhere along the line in your life there has been a stress, trauma, emotions, or some other kind of challenge that can happen to absolutely anybody.
Mhm.
I've seen, many, highly accomplished people that have suffered from this. And then the third message is that effective treatment is available. And the doctors who have learned how to do this, they absolutely love it because, the 40% of people that come to a primary care doctor that have this condition that used to frustrate and burn out their doctors, now there's a successful approach and it becomes, as it was for me, personally and professionally rewarding to work with people who have this. And one of the doctors who learned this from one of the courses on symptomatic.me, she took me aside at a conference and said these concepts had put the joy back into her work.
Oh, I love that. That's incredible. So, okay, for those of us who are like, how do we get more of Dr. Clarke? What we know the podcast is available, so I'm going to put that in the show notes. We know it sounds like both patients and doctors, practitioners, symptom.me is available. Is that correct? Both
Yes, symptomatic.me is
symptomatic.
available, and we have the website has got buttons on it for the public and for professionals, and so they each can go down their own tracks. And if I didn't mention it, I should mention this in the first 5 minutes of every podcast. I probably screwed up, but there's a 12 question self quiz
Mm.
um, on there that people who are thinking, well, do I have this or not? They can take the quiz, and it's set up in a way that the more questions to which you answer yes, the more likely it is that you have a neuroplastic process responsible for your symptoms. It
Ah,
takes less than 3 minutes.
wow. Okay, so we all need to be going and doing that quiz.
And yeah, doctors can, I encourage them to steal it
Yeah.
and use it in their own practice.
Yeah, well, let it. Yeah, everybody needs to be using that. Okay, and then tell us briefly, if you will. You've got other books that are available for us to read, and I'm going to be lining up to read those as well. So, what else? What other things can we learn from the other books that you've got out there too?
Yeah, there are now a number of science-backed books out there. The two that I edited have the older term. We use neuroplastic symptoms today. The older term is psychophysiologic disorders, and they're actually textbooks, but they're written without jargon. So people that are interested in the science behind this, they can easily read it. I know there are a number of neuroplastic therapists out there that recommend the textbook, especially the first one uh, called Psychophysiologic Disorders
Okay.
to their patients who are interested in the science.
Yeah.
There are also on the website books that we feel are based on science are recommended on the website, and there's a lot of them now, and they all cover this from different angles, so that if my book doesn't happen to work for you, there are others that come at it from a different angle that probably will. And there's also an app, being the 21st century, there's an app out there. It's called Curable. They do charge for it, but the it's got all of the ideas that I've shared with you today and more are incorporated into their user interface. Um, so that's another a good resource.
Excellent. Excellent. So we've got the podcast, we've got videos and a quiz, we've got extra books. I mean, you name it, we've got it. You've covered. We've got the
Oh,
an app,
I,
all the
I
basics.
also forgot we have for people who support us as members, if we're going to get the word out to the medical
Yes.
profession, we need enough revenue to support getting the word out and pay our staff and so forth. So people who support us by becoming members, they are helping us with our mission, but they also have access to a self-treatment course that's on there that's just for members. And every month we have a Q&A on Zoom with experts, and it's an international Zoom meeting. We have people that join us from Australia and Europe, and you can, for an hour, you can ask questions of our expert panel, and we do it every month for members.
I love that. Can we find that information through symptomatic.me?
Yep, it's all there.
It's all there, one-stop shop. We love it. Well, Dr. David Clarke, thank you so much for coming on today and sharing your knowledge, your wisdom, your expertise with myself and with the audience. I so greatly appreciate it.
Oh, you're very welcome, Kelly, and I really appreciate your getting this information out to your viewers. It's going to help us spread the word, so I thank you.
Absolutely, my pleasure.